And I want to start with just sort of the lay of the land here. What are some of the tests out there? Some, folks might still be very confused as to their options. Can you break down the different kinds of tests that are available?
Absolutely. Since earlier this year, when the emergency use authorization was first put into action by the federal government, we've seen an explosion of testing options that have become available. For detecting active infection, there are two main types of tests that are being offered in the market. Those are PCR testing and antigen testing. Essentially, while I don't want to go too far into the science, PCR testing is looking for actual pieces of RNA from the virus. Antigen testing is looking for your body's reaction to the virus. So they're very similar in some pieces of the virus that actually might be expressing can be detected by antigens versus the genetic makeup of the virus can be detected by PCR. They have varying sort of trade-offs that you have with each one of them. PCR testing is more accurate and has higher sensitivity across the board generally, where it's able to have a lower false negative rate for detecting even lower level infections. Antigen testing, on the other hand, is often faster and can be done much more cost effectively, although it does have often a higher rate of false negatives.
And at Phosphorus, which method do you employ?
We use PCR testing, and for both methods, the other sort of major consideration is modality. What type of sample are you going to be using in obtaining for the test? Most commonly used is a nasopharyngeal swab, which typically requires a healthcare professional to aid in the collection of the sample. We've validated, and we're, I think, the second in the country to receive approval for a saliva sample type to be collected for detection of the active virus. And this has a number of advantages, one of which, along with not being as uncomfortable as a nasal swab, can be administered without the aid of a healthcare provider. So as employers are thinking about getting their staff tested, sometimes the actual logistics of how do you collect the sample might require more interaction and more people-to-people time, which of course increases exposure. Saliva eliminates that, which is something that we think is really powerful.
Absolutely. Some of those benefits also, include sort of the timing aspect. We know that for many people who have been reading the news, watching the news, maybe not even gotten tested themselves or have gotten tested, they've realized that you go and get the test might not take very long, but the results take an extraordinarily long time. What have you found to be helpful in your own process to expedite that?
We use polymerase chain reaction, or PCR, in our process, and it's not a point of care test. It is a laboratory test, meaning samples have to be returned to our laboratory for results. We generally provide results within 48 hours, no longer than 72 hours. Some laboratories have gone upwards of a week to even multiple weeks to return results. I think it's really important that providers in our space are not selling above their capacity. These test results are not useful if we're not giving them to patients in a timely manner.
The timing aspect also comes into play when you're considering how to reopen your business and when to test certain employees, when to let certain groups in. Can you give us some of this insight that you've worked with your partnerships to sort of, give others who are looking at this timeline a better idea of how to actually deploy the frequency of these tests?
Yeah, we've done a number of partnerships ranging from retailers like Albertsons pharmacies all the way to regular employer testing in partnership with benefits managers and even direct relationships with firms. We work in New York with a number of financial services firms, as an example, that are deploying regular weekly testing for their staff. And the way they do this is they've actually, we've put together an online system where once a week, their staff members are able to fill out a virtual requisition form where they complete all the required questionnaires by New York State or whichever state they're a part of regarding symptoms, exposure, and their general risk. They're also then provided by their employer or by us directly the saliva collection kit so that they can do collection at home or on site at the office if that's where they're performing it. And those are overnighted back to our laboratory, and results again are typically within the next 24 to 48 hours.
And generally speaking, how have these practices worked out for these companies with respect to the frequency and how they're staggering workplace reentry?
So far, so good. We've seen that people have adhered very well to frequency when the barriers are really low to get tested. Again, they're not being required to find an urgent care center or get their own results. So I think providing a turnkey solution is really helpful in adherence to these policies. And with respect to staggering staff and whatnot, we're able to work around however they decide to do their reopening policies.
And a lot of it has to do with employee compliance. And so, in that way of out of clinic, in home testing, has that been an increase then in employee compliance? Has it led to?
We believe it has for the group we're working with. We don't obviously offer some of the other solutions out there, so it's hard to have a side-by-side comparison. I think one thing is nice is that because we can then continue to test staff members at home, if someone tests positive, whether symptomatic or asymptomatic, we can offer solutions where continued testing can occur without that employee coming back into the office to monitor when a negative result will be received and the infection has resolved.
I want to go back to the differences in the tests that are out there right now. When it comes to assessing an employer's acceptance of the risk and employees' acceptance of their own risk, can you explain the differences again in the testing and how it relates to where you could feel more confident in bringing folks back?
Yeah, so with respect to PCR versus antigen testing, the trade-off then again comes where PCR is a bit more expensive and takes perhaps a bit longer given that it's a day or two for turnaround time, but has the benefit of detecting positives down to low level and asymptomatic infections. Antigen test performance has had a higher rate of false negatives in most cases in populations that are asymptomatic or lower level infections. They're more cost effective and there are point of care antigen tests. So you do have the benefit with them of getting results sooner. Ultimately, this is a trade-off decision that's both cost related and then risk related. If you have extremely high risk individuals, I'd say a higher sensitivity test is probably warranted. If you're looking at a larger population, potentially of lower risk employees, it might be more appropriate to think about an antigen testing in that case.
And again, on the frequency of that, then if you're looking to potentially reduce your risk as much as possible, do you recommend any frequency with bulk testing?
Frequency is a good question. Again, it's always a function of cost. One thing I always like to remind people is that doing multiple tests does not decrease the error rate on the test necessarily. If you have a 92% chance of accuracy the first time, if the issue is biologic, that's not going to change the second time. If it's random, maybe it will. So I think frequency is often something that comes up as a mechanism people suggest to me to reduce the error rates. And I always like to point out that that's not necessarily what frequency does.
And in terms of looking into the future, I know that you are working on sort of a dual testing structure as we are getting into influenza season. Could you speak a little bit more to how these tests could also help distinguish whether employees have the flu and if or they have the COVID-19 virus?
Certainly, I think it's important that this is the first flu season that will have fully active COVID-19 in the population, presumably spreading at a rate that's not going to be as slowed down as the warmer months over the past few months. Differential diagnosis here, especially for those who are symptomatic, is really important. A lot of the safety measures that companies are putting into place certainly provide for temperature detection that applies to the flu as well. And we think that having a test that can detect both influenza and COVID-19 together, again, provides an added layer of knowledge and security as you bring staff members back to work safely.
All right. And just lastly, before we hand it over to John, Alex, and Anton, I want to ask about what you've seen at the government level. You've worked very closely, obviously, with the FDA. You see what's happening at state and maybe local levels. What certainty do we have going into the next couple of months around testing that you've seen, maybe that we haven't seen? Is there any plan from the government levels there that would allow us to feel maybe more confident that there is a plan?
I can speak to at least what we've seen with respect to the FDA and what they're trying to encourage in terms of test development. They've moved away from broad reference labs, so they're kind of not really working to even approve EUAs for general tests done in reference lab facilities anymore. I'd say they're very focused on newer technologies that can move the needle on cost and point of care diagnostics.